Some good and bad news on coronavirus infections in the U.S. The CDC predicts a spike in cases this month, followed by a sharp drop-off in July. Officials say all of this, of course, hinges on high vaccination rates and continued following of health and safety guidelines like mask wearing and social distancing. So internal medicine physician Dr. Stella Safo joins us now to dig a little deeper into the most recent COVID-19 research. Thanks for joining us, Doctor. So the CDC also said that, these COVID variants could be the wild card here in the U.S. A new study shows that Pfizer's original vaccine is highly effective against the variant that was first detected in the U.K. Preliminary data also shows Moderna's booster shot offered increased immunity against variants first found in Brazil and in South Africa. Just explain how booster shots work and when they might be available to the public.
So the good news is that many of us are used to booster shots. A lot of vaccine series that you've gotten, especially childhood vaccines, actually are based on the idea of starting your immune system off and then priming them with a booster shot. I think that what we all wanted for the COVID-19 pandemic was to get a vaccine that would work and we would be done with it, period. Unfortunately, that's not the case. COVID, like all viruses, has mutated. And when a virus mutates, basically what's happening is that you're seeing a slightly different version of the virus. It's kind of like what we see with the flu every year, of a slightly different version. So the idea with the booster shots is that it lets us have the latest information on the most virulent or deadly COVID strains that are out there. And then it lets us design a vaccine that'll take care of and protect you against that particular strain. So again, we know that this is how viruses tend to work, and the booster shot technology is something that we've seen and have had historically, and we should probably start seeing these roll out by the end of the summer or early fall.
That is some good news. Meanwhile, Doctor, as you know, researchers in the UK are looking into whether or not getting 2 doses of 2 different COVID-19 vaccines could boost immune response. Health agencies in France and in Germany are already encouraging people who got the AstraZeneca shot to consider getting a dose of Pfizer or Moderna. What is your take on this? Is mixing and matching, is it safe? Is it practical?
So I am an HIV primary care doctor, and again, the good news is that this isn't new. When it comes to HIV, there's been a lot of work that's been done in looking at what it would look like to actually mix vaccines, potential HIV vaccines, and see how they would work with the immune system. And so the thoughts for this are there. And the idea is that if your immune system gets smart by seeing a version of the virus, what if we could make it even smarter by showing it 2 different versions from 2 different vaccines? The issue here is that the initial studies weren't done with mixed vaccines in mind. And so even though the ideas behind this are not new, we haven't done the phase 3 kind of large-scale trials to evaluate what it would look like to do this with 2 different shots. We believe that it should work, but I think that's why there is a bit of caution. And at least here in the U.S., we're saying, we're going to kind of stay with the 2 Moderna or 2 Pfizer because it's what the data supports. You can understand, though, that in other contexts where, for example, you're no longer using AstraZeneca or you have other limitations, that, the kind of 2 different vaccines could be an option.
The Biden administration has agreed to temporarily lift patent protections when it comes to coronavirus vaccines. Explain how this could potentially help when it comes to the global fight against COVID-19.
It's a game changer. Many of us have been talking about it in the community and kind of wishing that this had been done from the very beginning of the vaccine production. Obviously, the manufacturers and the kind of innovators behind vaccines wanted to protect their intellectual property. But when you have a global pandemic that can only be solved if all of us are safe, then you really need to set up the structures that will allow all of us to be safe. And so what this waiver now means is that it will allow middle and low income countries to be able to access the vaccine technology, kind of like the blueprint for how to make the vaccines, that'll allow them to get access to these vaccines, hopefully en masse. And that could be the difference between, turning around the devastation we're seeing in Brazil, in India, in a short amount of time. And the benefit, and the reason why I think ultimately we should all celebrate this, is that if others are safe, then all of us ultimately are safe.
The other interesting sort of, I think, nugget is that several recent studies have shown that COVID-19 could trigger diabetes in people who are not previously diabetic. The research on this is still in its early stages, but explain how there could be a possible link.
COVID is a pretty incredible virus and not incredible in a good way, but just incredible in all the things that it's showing us. It has been linked to long-term cardiovascular disease, long-term neurological disease. So it isn't totally surprising that we're now seeing some suggestions that there might be some endocrinological challenges that now come after you've had COVID. So diabetes is a disease where you're not making enough insulin within your body. And the thought process there is that perhaps COVID itself, through different mechanisms, the SARS-CoV-2 virus actually attacks the pancreas in a long-term manner that then leads to downstream impact on your ability to make enough insulin to protect you from having diabetes. And unfortunately, if you can't make enough insulin, you now have to have other ways of having control of your sugars. So it's still early, but I think the thing that we're seeing that kind of makes sense for this is that COVID has been shown to cause long-term impact on different organ systems. And it's part of the reason why, while most of us will be totally asymptomatic, some of us will have long-term symptoms. And so it's even more reason to get vaccinated so that you can just prevent yourself from having any issues and not getting COVID at all.
So since the beginning of the conversation about vaccines, we've heard over and over again what we're aiming for is herd immunity, herd immunity. But now we're hearing sort of some interesting details, and they're just different countries here and there. The world's most vaccinated country, the Seychelles, speaking of great places to go on vacation, it's now reinstating COVID restrictions. More than 60% of its adult population is fully vaccinated, but a recent surge in COVID infections is certainly raising the alarm. And then there are new cases that are also being reported in Australia where the virus has basically become non-existent. So I'm wondering what the implications are when we talk about, aiming towards herd immunity. Is that even really realistic?
I think it's a great question for us to be thinking about. And the Seychelles offers us a real world example to really think about this. So they're at about 62% coverage in terms of their vaccine rates. And what's interesting about that is that isn't actually going towards the 70 to 75% that we expected to get to herd immunity. So they're still a little bit below that. But even when we said that we were, aiming for herd immunity, we actually didn't know about the strains that are now so infectious. And so the models are now saying that to get to true herd immunity, you'd have to get closer to 90%. And as we know, COVID is a infection, unfortunately, that has caused a lot of political fighting, and many people won't get vaccinated. There's estimates that up to 30% of our population won't get vaccinated, and that's in the US. And so what that means is that we may never get to 90% that would require herd immunity. And so I think that the targets are changing for us and the language is changing. It isn't so much that we're convinced that we'll get to herd immunity and everyone will just be safe because coronavirus will no longer be in the environment. It's more that, again, avoiding high-risk individuals from getting sick to begin with and having long-term impact from COVID is the goal, has always been the goal, and remains the goal as we really try to push out wide-scale vaccination. But I think the Seychelles is a cautionary tale.
But so that's my other sort of follow-up question, Dr. Safo. I mean, in a lot of these other countries, this virus, this pandemic has not been politicized in the way that it has here in the United States. And we've done a lot of reporting in the last couple of days on people who are just simply not going to get the vaccine. And the excuses range from, I know that this triggers liberals, so I'm not going to do it, or people who believe that it could be harmful to them, to their health, to the health of their unborn children. I mean, there are a lot of different, the varieties are infinite, but as to why people won't do that. So to Anne-Marie's question, are we ever going to achieve herd immunity? And if we don't, are we vulnerable still? In other words, there are some people who say that they would probably continue to wear masks because, as you know, this is something that people do in other countries long after pandemics are over. If people are even just sick with the flu or if they have a cold, in certain countries, people wear a mask because they want to protect the people that they're commuting with. They want to protect their coworkers. So are we still at risk here?
I mean, I think that it's been really nice for many of us to not have had a cold in the last, 14 months. And that's reason alone to keep wearing masks, right? I think that this conversation is an interesting one because when we first presented the ideas of wide-scale vaccination, we said it would protect you as an individual from getting COVID and having the side effects or the long-term impact of COVID, but it would also protect us on a population level. So I want to emphasize, if you get vaccinated, it will still protect you as an individual. And remember, if you're living in a community, like there's some communities like San Francisco and other high-income communities where they're seeing 90%, vaccinations. In that local environment, they're going to get towards something that probably is like herd immunity because they're not going to have high-scale transmission in the local environment. I think your question, though, is a good one. What happens if our population doesn't get past the kind of 50, 60, 70, up to 90% that we need for the population to be protected? That's really for us, I think, to kind of deal with and to think about what we as a population want for us as a population. But as individuals and in local environments, the reality of population protection through wide-scale vaccination, I think, is something that is still possible and that we should still absolutely aim for.
All right, Dr. Safo, really important information. Thank you for being with us.
Thank you for having me.